everyone! Welcome to the Smile Project, a podcast from School of Dentistry. I am you.
Thank you for joining us today. This podcast is all about holistic dental education on the go. This would enhance your knowledge and attitude not only towards dentistry, but life as a whole.
Tune in to hear and learn from specialists from various fields of dentistry, sharing their experience and discussing topics in the realm of dentistry. Also, we have in store a small dose of inspire and influence, a section for quotes and productivity tips. So, let's begin! Welcome back to another episode of the Smile Project podcast. So in this episode, we're super excited to have Prof Tilakaratne, one of the stalwarts of field of oral pathology and medicine. So Prof is a past president of International Association of Oral Pathologists, and his areas of expertise is oral and maxillofacial pathology, oral cancer, and OPMD. He also has numerous publications and book chapters to his credit. Currently, he's a professor at the Department of Oral Maxillofacial Surgical and Medical Sciences at the Faculty of Dentistry at University Malaya. So we are so excited to have you in our podcast, Prof. So thank you so much for joining us today. So Prof, let me just throw you the first question. So you were a board certified surgeon, am I right? And before you became a pathologist. So yes. It's a bit unconventional, right? So what made you choose that? What made you make that decision?
Okay, good question. I like that question. Well, when I was a student also, I wanted to become a pathologist rather than a surgeon, right? Because I'm from Sri Lanka. And the time that I graduated, we did not have any postgraduate program in pathology, right? Not that I don't like oral surgery. I like oral surgery also, but if I'm given a choice, I would select pathology. Because I did not have a postgraduate program in pathology, I had to do some postgraduate, so I opted to do my next the pet area, the oral surgery, right? So then, of course, I never, forgot my main ambition. And after that degree, I decided to do pathology. Then I went to UK and I did my all pathology qualifications in the UK.
Oh, that's
and
wonderful.
I feel, to be frank, maybe in a clinician and a pathologist, I think I see the problems, the especially pathology problems, the cases when it comes to diagnosis in a broader sense and broader aspect than a pure bench pathologist. Because I have a clinical pathological correlation. Right?
Yeah.
Before I looked at the slide, when I read the clinical history,
yeah.
I have a better understanding as to what I'm going to look at.
Yeah.
So that's an added advantage. Still, I like surgery, but if I'm given a choice, yes, pathology is my pet area.
So, Prof, what attracts you to pathology?
Yeah, the pathology, from my student days, as I said earlier, I realize it is the pathology which tells us about the disease.
Yeah.
About the disease in every aspect, how the disease is caused, how the disease is going to progress, what happens if you do not treat, like natural history. So all those aspects are taught and can be learned in pathology. But if you do other areas, I don't think we get the broader sense of every aspect of the disease, right? And being a pathologist, you can be part of the management team also. For a particular disease. So therefore I find pathology is more close to me than any other subject.
Yeah.
Very interesting, Prof. Also, I remember during your talk earlier you mentioned that if a clinician doesn't have knowledge of pathology, they're basically like a blindfolded clinician. So now I really understand as I went through your talk earlier. So also, doctor, how or what is your routine if you have a very challenging histopathology case, and what is your approach to that case?
Well, to diagnose whether it is a challenging case or not, you have to follow the basic principles, right? One has to follow the basic principles.
Mhm.
So as I said in the lecture, so you need to have all the clinical details to start with, right? The history and other clinical findings, the imaging findings, right? You need all that. Before looking at the morphological features, the slide that you have got for the particular case, you need to have the better understanding, right? So clinical features are these, the imaging is this, now this could be one of these, that kind of a broader the image about the disease you should have. Having that, you look under the microscope, then you get a broad idea, right? So you should not jump to the conclusion directly, right? Prejudice is not allowed in diagnosis.
Mhm.
So therefore,
Yeah.
it's very important for the pathologist to combine all the clinical, radiological features and other findings from various serological investigations if they are provided. So then you look at the histopathological features, and I think at the end of the day you get the correct diagnosis.
Yeah.
Right?
Yeah. And talking about diagnosing or pathology, how often do you use immunohistochemistry tests? Yeah.
Yeah, the most of the diseases in the oral cavity can be diagnosed without immunohistochemistry or other sophisticated molecular testing. Immunohistochemistry is important when it comes to neoplastic lesions, right?
Mm-hmm.
So especially, if you have a poorly differentiated lesion, histologically, then one needs to use immunohistochemistry.
Mm-hmm.
To decide what lineage of cells you are looking at, right? Whether they are lymphocytes, whether they are mesenchymal cells, whether they are epithelial cells, that broad differentiation for undifferentiated malignancy can be arrived with immunohistochemistry. So that is the starting point.
Mm.
But then if you want to diagnose what particular specific tumor it is from within those categories I mentioned, within the mesenchymal, within the epithelial, there are so many, right?
Yeah.
Hundreds of different tumors. For you to diagnose them as to what it is exactly, various immunomarkers are helpful.
Yeah.
So that's a very broad area, right? It's
Yeah.
a subject by itself.
Mm.
So immunohistochemistry helps in that way. But there is another technique called immunofluorescence that I showed you, which it is very similar to immunohistochemistry, but you look at the slide under a fluorescent microscope because the antibody is coupled with a fluorescent dye. So that test is also very important, especially in oral pathology and the dermatology, because to diagnose the autoimmune distant disorders, immunofluorescence is a must. That not only help to diagnosis, but the immunofluorescence findings help to manage the patient as well, right? How much steroid you should give, etc.
Yeah, I understand.
Also, Prof, what is your opinion on digital pathology?
Yeah, digital pathology is a very good thing. But in the developed world now, you can see a lot of cases are diagnosed with the help of digital pathology. I'm sure in the future, at least good 80% of the cases should be able to diagnose with digital pathology. But still, if the human mind finding it difficult to come to a differential diagnosis or the correct diagnosis, computer might find it even harder because there are difficult cases. But that cohort of cases you need a pathologist. Definitely.
Yes.
You can never replace the pathologist with digital pathology 100%. That is for sure. But digital pathology will be helpful, right? For the cases which have the textbook appearance, all the 1 to 10 features are there for this tumor, that kind of justification is there, then digital pathology is helpful. But digital pathology can help in many other ways. In the diagnosis as well. So we also do some research using AI and digital pathology. So that's a good area.
Yeah, right. Yeah, that's. Thank you for sharing. All the all your insights on diagnosing a certain disease. And so you worked in Sri Lanka before you joined the University of Malaya. So what difference do you see here in the students compared to the students here and the students in Sri Lanka?
I don't see much of a difference. When I look at the Asian students, I think Asian students are different from the students in the West.
Yeah,
right?
yeah.
Because I worked at the University of London for a significant time as the professor of oral pathology. Our students here in Asia, they don't come forward much, asking questions, etc. But I'm not telling they're not knowledgeable. They're very knowledgeable, probably. But asking questions, the self-stimulation is little less.
More restrained.
Yeah.
Okay.
Yeah, I think more conservative approach. I think. But otherwise, if I compare the Sri Lankan students and Malaysian, I don't see much of a difference. When we ask them to ask questions, if they have any, not many students ask questions. That's probably a common thing in Asia.
Yeah.
But it's perhaps different in the West.
Yeah.
Also, Prof, you're such a big name in research, in the field of research. So, how do we, as beginners in dentistry, how do we take steps forward towards research?
Yeah, that's actually, as a student, if you have an interest in research, I think you should start that at the stage of a student, right? So you don't need to go for big research to start with. Always as beginners, you can just write your case reports, when you find an interesting case, right? It is not a big research, but you can write a case report on the particular case, right? And then once, you publish it, then you get some self-satisfaction and you feel like, planning something better, right? So then you can perhaps move into very simple clinical audits. You have many patients, you treat when you are a student. You have a record of all the cases that you do, and you just look at, the same disease you treat in different ways, and you see what way that you treated works well for the same disease. So that is a clinical audit. So by doing so, you can improve yourself and you can distribute that what you got to others, your other colleagues. So that is the beginning. Now most of the time when we come to research, people say there's no time, we have no funding. So you don't need funding to do research all the time, because especially in the field of medicine and dentistry, you have enough material from your patients. Those patients, the clinical findings, as I said earlier, clinical audits, so various comparisons, although it's the same disease, the 10 patients may present with 10 different the clinical presentations. So you can compare those, you can report those, that kind of things. You don't need money, right? And the time factor is also not a big issue to do that kind of research work, because there's nothing, lab time involved, etc. Right? So you have to start small, right? With time, you can expand it. Once you graduate, so you can get the help from your peers, from your teachers, etc. to plan proper research. But until such time, you can get involved in little things, right? So that will inculcate the idea of research within you, right? So then one day you can, I'm sure, become a good researcher.
Thank you so much for that advice, and I'm sure a lot of aspiring researchers or pathologists will be so grateful for your advice. So maybe a last question, but what is the one moment in your professional life that you've gotten great joy from and that you'll remember forever?
Well, there are many, because now I have come to the last part of my academic career. There are so many, because as you both were talking about research, there is something that I enjoy, right? I don't know whether I would stop doing research until, I say the last goodbye. So I might be doing some kind of research all the time. Out of the award that I got, the award that I like most is when I got the Best Researcher Award in the country in health sciences, right? Including medicine, dentistry, veterinary science, right?
Yeah.
So that probably, if you ask me what my most joyful moment in research and in academic career, I think probably that is one of the biggest moments. And also, the I'm from a small country, the developing country. When I became the president of the International Association, I think that was also a very joyful, big moment for me.
Yeah, I'm sure it must have been. And maybe one take-home message or one aspiring note to all dentists out there, or all oral pathologists, or even dental students. Maybe just a small takeaway to tell them.
Yeah, my way of practicing dentistry, or for that matter oral pathology, is based on commitment, dedication, without postponing any work that should be done today to tomorrow, right? Irrespective of how busy you are, you have to manage your time correctly, right? Time management is very important, right? So if you manage your time correctly with your dedication and commitment, I am sure anyone can reach their goals without any problem.
Okay, thank you so much. Thank you so much, Prof, for joining us today, and we are so very grateful to have you on the podcast. And we just wish you well. We wish you all the best. And Aruna.
Yeah, thank you so much for being so
Warm.
For being so warm, for being so welcoming, and for really answering every single question. Thank you so much.
Okay, thank you very much.
All
My
the very-
pleasure. All the very best.
Thank
Thank
you.
you.
Thanks for listening to today's episode of the Smile Project. We hope you enjoyed.
If you would like to help support the podcast, please share it with your family and friends and leave a rating or review. Thank you once again, and I'll see you next time.
Bye.